If anyone tells you that you have to enroll for Medicare at 65, tell them they are wrong. Today, you'll learn the 3 different times you can enroll for Medicare, when your coverage becomes effective, and the penalty you could pay if you do enroll later than you are supposed to. Pay attention to these 3 different times because learning how they work will help you realize when do you have to enroll for Medicare. Now, there's 3 different times that you could enroll for Medicare. The first is at 65 with your initial enrollment period. Another is the special enrollment period, which is after you lose coverage from your current health insurance. And the other one is the general enrollment period, which is when you can sign up if you didn't sign up during those first 2 times. Let's talk about first the initial enrollment period, because that is the one connected to 65 when most people will sign up. So the initial enrollment period, the IEP, is based on the month you turn 65, and it's the 3 months before, and it's the 3 months after. Sounds pretty easy, but there's some caveats in there. Although thankfully, there's a change that took effect in 2023 that made things a lot easier. Before, it was nuts. You might have had to wait 2 to 3 months after you signed up to get your Medicare effective. Or maybe you signed up in January and waited all the way to July 1. So this is a great rule change. I think it's more understandable. It's more fair. So when you sign up for, well, when you hit 65, you've got the month you hit 65, you got the 3 months before you turn 65, the 3 months after you turn 65 that you could get your Medicare started. But there's a few things to keep in mind. One of them here is that it's based not on your birthday so much, but on the first of the month, where you might have a birthday of January 31st, and the question most people say to me, or they end up assuming, is that, oh, my birthday of the 31st, that's when my Medicare is effective. I'll just sign up before then. No, Medicare is effective on the first of the month. So we're going with January here for this example. If your birthday is January 31st, the entire month of January is your age 65 month. The entire month of January is when it can start, and it's the first of the month, even 30 days before your birthday hits, is when Medicare could be effective. Now, whenever you sign up for Medicare on this birthday month or later, it's most likely Medicare starting for you the first of the next month. So if you wait until your actual birthday month, and you even sign up before your birthday, and you think you're getting Medicare right away, it is the next month. Now, in this initial enrollment period, you're 65, you're not 65 yet. You can't get Medicare below 65 unless you're on Social Security disability, some other reasons. But for most folks, you can't get Medicare here beforehand. You sign up these 3 months ahead of time. So go on this January example, October, November, December. Then it becomes effective that 1st of January, that first of that month when you turn 65. Now, if you sign up for the 3 months afterwards, the February, the March, the April, it then is effective. It's effective the next month. You sign up for in January, it's effective in February. Sign up in February, it's effective in March. Sign up in March, effective in April, so forth. So that's the initial enrollment period. My advice is to sign up ahead of time so you don't have to worry about this situation where maybe you wait until you get to your birthday month. You think, I just sign up before my birthday, but then it turns out you don't even have Medicare yet. You can't get Medicare until the next month when you sign up. So try to sign up with your initial enrollment period before your birthday month. And keep in mind the special rule that comes into play if your birthday is on the first of a month. For whatever reason, when it comes to Social Security, but in this case especially Medicare, if your birthday is on the first of the month, your Medicare month starts the month before. They say the day before you have your birthday is when you're eligible for Medicare. So if you're someone on the first of the month, just shift everything back 1 month. Keep that in mind with your initial enrollment period. The second time you could be able to sign up for Medicare is with this special enrollment period. The special enrollment period starts the first month after your initial enrollment period. So if you are turning 65 in January here, and then the initial enrollment period goes through April, anytime that you don't sign up by the April, you could be late signing up for Medicare, but you might also have the special enrollment period. So we're going with this January example. So anytime May on forward after you turn 65 for this example, you could have a special enrollment period. Now, a special enrollment period is for someone that didn't sign up right away at 65, but is continuing on with group health plan coverage. This is why when people tell you have to sign up at 65, the answer is no, I don't have to, but there's all these things that maybe you really ought to. If you are still going on with group health plan coverage and you are part of a company that has more than 20 employees, you actually don't have to sign up for Medicare. You may want to continue on with your group health plan, but at some point in time, you'll stop working or you'll lose that health insurance for whatever reason. So you're on that group health plan. Maybe you stop working, maybe the group health plan goes away. You might have chosen to do that. But let's just say that you're going to retire. You're going to retire in June and you were 66 years old, so you're already well past that initial enrollment period. You're retiring in June, and what happens now is you have 8 months after that time frame to sign up for Medicare. You probably don't want the full 8 months to wait because where are you going to get your health insurance from? So you might want to sign up for your special enrollment period ahead of time, as much as ahead of time as you can go, where it's after this initial enrollment period, all the way up to 8 months after you lose health insurance coverage. So if you're retiring June, you're already 66, April, May, June, you may want to sign up for your Medicare. Get ready for it. It's part of your special enrollment period. And for them, maybe it's July, you want Medicare to start. Or you retire and it's June, you stop with your current group health coverage, you're on COBRA, and then you realize, oh my goodness, I need to sign up for Medicare. Well, you've got that 8 months after your employment stopped or after your health insurance coverage stopped, whichever one of those is first. So you've got quite a bit of time that's on there. That's that special enrollment period. Pay attention to that, and also pay attention to the idea that the initial enrollment period kind of trumps the special enrollment period. Let me tell you about someone I met a few years ago where they had a birthday in October. They're retiring in December, and so they wanted their Medicare to start on January 1. And this is back in the time where you sign up on 1 month, and maybe depending on how long it was, you waited 2 or 3 months later. So we looked at all the rules with the special enrollment period. Well, their birthday in October, right? 3 months later is they're still in that initial enrollment period. So when they signed up, trying to make use of the rules for special enrollment period, they were actually in the rules of the initial enrollment period. There's a 1 month gap there for them. Now, thankfully, that is really gone now with this idea that when you sign up in 1 month, your Medicare is covered. It's available to you right away the next month. But pay special attention and understand when you're retiring, maybe around your birthday, it's not your special enrollment period that might fit. It's the initial enrollment period, and look at the rules of the initial enrollment period. But also, if you are going beyond working past 65, you're part of that healthcare group where you are getting current employment coverage for your health insurance. You've got more than 20 people in your company there. You can sign up for Social Security. You can sign up for Medicare later on, and you don't have to sign up for age 65. Just know the rules for the special enrollment period so you can get into Medicare without a penalty. Now, let's say you didn't sign up for Social Security. I keep saying that. Everyone does it. Now, let's say you didn't sign up for Medicare during the initial enrollment period. You even missed somehow the special enrollment period. It's not too late. Every year, you do have the ability to sign up for Medicare. That's called the general enrollment period. So you've missed all these. Let's talk about the general enrollment period. So the general enrollment period, the GEP, that's in January, February, and March of each year. So January 1 to March 31, right, all the way through, where you can sign up for Medicare, and you've already missed these initial enrollment periods. You missed the special enrollment periods, but you can sign up for Medicare, and you will get then Medicare available the next month. You sign up for January, you can get it February 1, February, March, it's with the next month. Thankfully, that's the case, because the old rules, they made you wait all the way till July 1. So they've made the rules a lot easier. And you've got this general enrollment period now. If you miss the first two options, you've got the ability to sign up here, get your Medicare the next month, but you might pay that monthly late enrollment penalty. Let's talk about how that applies to you, how much that might cost. So if you didn't sign up for Medicare when you turned 65 with that initial enrollment period, or you didn't sign up even in that special enrollment period, and now you sign up with the general enrollment period, you can get part of Medicare, but that Part B late enrollment penalty probably applies. You would have an extra 10% cost for every single year that you waited or didn't know. You could have signed up for Part B, but you didn't. That penalty is applied, it's added to your monthly Part B premium, and it's not a one-time late fee. You will pay that penalty for as long as you have Part B. So if you've signed up and you're 1 year late and the cost is $175 a month for Medicare, then that's $1,750, 10% more per month that you pay extra for the rest of your life. Or in the future, these Medicare Part B premiums go up. So that penalty goes up. It's just whatever the premium is, it's 10% more because you missed it by 1 year. Or you missed it by 2 years. And now it's $35 a month, right? If that's the price, it's 20% more, $35 a month for the rest of your life. You could be 10 years, 20 years that you waited to sign up and you're paying 100% more or 200% more of whatever the Medicare cost would normally be. That's an extra penalty amount, which is why it's so important to pay attention to the initial enrollment period. That's why so many people say you have to sign up for Medicare at 65, which is not the case, but for a lot of people, they ought to. That's why you need to pay attention to that special enrollment period, because maybe you didn't have to sign up at 65. As soon as you lose that health insurance from your current employer, that current group health coverage, that's when you'd want to sign up. But if you miss it, thank goodness you have that general enrollment period that you can sign up, get Medicare starting the next month, and just realize there'll be a 10% cost for every single year that you had waited and hadn't signed up for Medicare. Hi, I'm Jeremy Keil, owner of Keil Financial Partners. And if you're interested in seeing how we help our clients get more income, pay less in taxes, and avoid big retirement mistakes, make sure to go to keilfp.com. That's KEILFP.com.